Hey guys, it's Adri here with Stacked Posture and Essentially Oregon. And if you have a better name for me as I combine my massage and essential oil and posture videos, then let me know and I'll take that in consideration. Just put them in the comments. So today I'm going to be going over my hospital bag and excuse my out of breath. I was throwing this together because it's nap time again, and yeah, I'm a mom. So I wanted to show you what I have in my hospital bag, as well as some tips leading up to birth and labor and delivery, and what I'm doing with my hips, and some other tips for you with also some essential oils. So we're gonna kind of hit all of it today. So here we go. Now, take into consideration, especially if this is your first baby, are you a visual person? Are you a tactile person? Are you an audio person? What is going to help you focus on what needs to be done as you are progressing throughout labor. Everybody's labor is different. Even baby to baby can be different for you. So take that in consideration. I'm a little bit visual, a little bit tactile. So I like to have a little outfit hanging up kind of in the corner of the room that I can just visually look how cute this is. Okay, she's gonna wear this. She's gonna go in there, I'm gonna be holding her, and I can visualize that. So I really like something like that hanging up. I have a couple other options. I'm gonna put her in some jammies, so depending what I want. Now I made this lovey for her sister, but it's not her favorite. So maybe this will be Adelaide's lovey instead of Olivia's. And it's silky, so that can be a tactile thing. Keep that in mind. Also got the minky. I had this as a baby, so I brought that along. At least I'll just put it in her car seat. And it's knitted, so just lots of different ideas for visual, and then obviously audio, your favorite music list or a calming music list, or making several music lists, worship lists, because what you think you might want now might not be what you want when you're actually laboring. So having options is always good. With Archer, it was like, I want music. Okay, never mind, turn it off, that's too annoying. Switch the music. So yeah, and that's fine. Soap, I like to bring my own soap because hospital soap is often, and I'm doing hospital birth, whether you're doing home birth, whatever, obviously you're home, you can choose what you want, but for hospital, their soap's often so drying. So I like to bring my own, and mine's way better. Spray. And now I also made a very in-depth essential oil labor and delivery video. So if you want to know why I'm bringing each of the things, and I'm not even going to go over all that, then check that out. Okay. Diffuser, must need. So here's my baggie full of different essential oils. I've got the entire emotional aromatherapy line, as well as our original line, and some other ones to diffuse. These are all neat, so I just threw them in here, so I can go, I don't know what I want, and I can smell and be like, yeah, put that in, as we're going through different things. The great thing about the emotional aromatherapy line is they're named cheer, motivate, forgive, console, so you can kind of say, okay, I'm feeling a little mad at this precious little one inside of me. I need some console, right? Deep blue rub. I've got several different concoctions with black pepper, copaiba, clary sage, peppermint. I've got our past tense, a few other things for pain. The aroma touch is going to be more so for circulation and calming down and tenseness here, and then the different pain stuff is going to be mostly lower back application. And again, you have to find what works for you. So that's kind of it for essential oils for me. I've got the pain ones and the relaxing ones and the inspiring ones. Don't go to the hospital without something though, if you want some sort of a touch, or you think you might. So the arnica oil is great, anti-inflammatory, really great one for relaxing muscles. Okay, I use it all the time as a massage therapist. Or just coconut oil, something that if you feel like you want, your significant other or doula massaging in there, definitely you can be doing now the forbidden pregnancy point, okay, right here. So the trap, second head trap, right in the center there, and you push down, bearing down. We want energy down. So foot massages are really good. Stroking downward, pushing down. An easy one for your partner to do is if you're on a chair or the ball, like a birthing ball, yoga ball, they can take their elbows and just lean on you. Okay, and that's easy for them to do. They can do that all the time. It's like you're leaning on a counter, right? Or elbow if you want more pressure, okay? So just be in communication, or they can use hands. With that, it usually feels really good. It helps relax the whole head because you want to soften your jaw, okay? It's back, okay? Back and soften this way because the jaw and the mouth, the cervix mimics that, okay? So if we're tight, the cervix won't want to dilate and be open. As we're all tight through here, you're gonna be tight everywhere. So we want to maximize everything relaxing, everything being calm, and energy coming downwards. So really slack that jaw as you're breathing. You can still do different types of breathing movements while your jaw is still relaxed. Okay, it's really important. All right, so I've got an awesome little concoction here. That's what's in it. Our helichrysum, frank, and Roman chamomile. This is for peri massage. So as the doctor's like trying to help you and, oh, you're almost a 10, like give them one of your own instead of like that gross lube that they have, okay? Yeah, that's way better. And peri spray, again, I've got the other video. Ooh. Our sanitizing mist. I love that it's a mist. You can do your hands all the time or just spritz wherever, as well as, yeah, I've got the bigger one to spritz all over the room. Okay, you've been taking your prenatals, right? So don't forget them. Okay, I just put all of mine here in the On Guard Plus container, as well as I've got PVSys Junior sachets, which are amazing. Okay, if you're gonna do collays, that's fine or whatever, but I highly recommend 1 to 2 of these. I'm doing 2 right now a day, leading up now that I'm 40 weeks and then some. To help keep it regular, because that bowel movement post-baby can be traumatic for a lot of women. So make sure that whatever you're choosing to do, be consistent and take it with you to the hospital, okay? Do not want to forget that, as we want to stay regular. LLV with the cellular support has a lot of energy, safe energy, supplement coming into my body to support all of the energy I'm going to be exerting, okay? So I'm definitely doing a full dose of that. All right. Other stuff in the hospital bag, take a change of clothes. They have the hospital gown for you, but definitely when you're going home, I've got a super loose yoga pants and super loose nursing bra, okay? Kind of like a sports bra. And I just got them off Amazon. This one might be, yeah, this one's Target, but just something really loose and just forgiving, and then use their mesh panties, okay? Definitely if you're a new mom, you're like, what is that? Like, they'll know. They'll be like, do you want to use some of these? Or they'll just be giving them to you as you're bleeding, and they'll have the great pads for you. Use them and ask for more to take home, okay? They will be more than happy to be giving you that to take home with. Okay, I always stock up on that, and some newborn diapers. Like, can you give me a few more? Because I've got some at home, but all babies are different when they actually come out. So some are still in the newborn size. Some are like, oh, maybe I should go to the 1. So getting a little bit of that buffer for that first 2 days to know what you need going home is really nice. Really loose shirt, a shirt that's a V-neck is really great because, hello, please try to breastfeed, but like, so you can just have access there and not have to be doing all this type of stuff. And most hospitals have lactation consultants there for you. So if they don't come to you right away, ask about it. Say, hey, is there a consultant here I can talk to? I'm having these issues. Some of the nurses are good, but like, you really want somebody who specializes, because their knowledge is just amazing, okay? Really great. What else have I got in here? Not much. I mean, your own socks. They've got the socks too, and I always go with black because, ew, hospital, right? And everything gets washed when I get home. So only take what you're willing to wash like the next day you're home. Bag of toiletries. So I love having, if you're gonna do throwaway ones, you know, whatever, but I love Norwex. So these are the body cloths, and they're just fabulous. My sister sells it. I can put that link in the bottom here, because then you can just be, hi sweetie, hi. You can just be cleaning as you go. You just get it wet, takes makeup off if you like just run to the hospital middle of the day, right? You know, and you've got your full face and I forgot my makeup remover. Nope, you just need these. Mwah. Nap time's over for this one. Toothbrush, you know, that typical stuff as far as doing your cleaning routine afterwards, but really you're only there a little bit of time, so you don't need to very much. I like taking a robe. This is more my thin one, but it's really cozy. I've done the thicker one too, and it's just really great to have, don't kick please, really great to have as an extra comfort, or just then you don't have to feel like you have to cover up with their, you know, their warm blankets, but then they cool off and you can just have a layer lightly on you.
This is tried cold pop.
Yeah, we did. Yeah, got our own soap. That's really great. Yeah. Okay.
That for wash hands off.
That's right. Can you go up onto the bed, sweetie? And I will be with you in a minute. Okay. Can you get up? Hang on. Yeah. Okay. Real life. All right. So now we're getting into more of the posture stuff as you're trying to loosen up and relax for baby. Okay, so a lot of times if you're on the ball or on a chair, you're going to have your partner or doula be pushing your iliac crests together. Okay, so SI joint, lower back, okay, your iliac crest, that big hip bone, pushing those together to widen the base, okay? And depending on how tight you are, it might be a little sensitive, so see what feels good for them and for you. Another way to be doing this, especially yourself before you go into labor, is to be doing our butt pulls, okay? So that's when you go underneath as you sit up. So if you've not done my sitting video that I recorded, go look at that. So what you're gonna do is once you sit, right, we hinge, okay, really get those butt bones back behind you and under you. Okay, so now I'm on my sit bones or a little bit further towards my pubic bone, ideally, okay? Now you should feel the bones, but most of us tend to be a little tucked under and our glutes to be kind of tight, so we want to relax all of that. So you're gonna come under and you grab that sit bone, basically, and you pull it wide. And you can push from your pubic bone and push wide, okay, and pull wide. So you're really getting this movement to fully open up that area so your baby can drop a little bit lower and be able to engage your cervix a lot better. Don't touch, please. So that she or he can come down and really fully engage, have a lot of space down there. Because the more tight we are, then the longer we're gonna have to labor for, okay? And I've already had her come down lower than my other two. Of course, she's the third. So hopefully that's also helping me as I'm preparing to hopefully go into labor any moment now. So those are just some tips for you guys. Keep it simple, the hospital bag, like a change of clothes, you know, your visual or audio, whatever essential oils you want to be using or think you might. I've got a lot, but just take something to support you. As well as hospital robe. I love that. If you like slippers, you know, take the slippers. Again, I love to wash everything, so keep that in mind as you're taking stuff. Make sure the car seat's in your car, okay? If it's not installed yet, at least make sure it's in the car because your husband can go out and, you know, cinch that in whenever, right? And your supplements, okay? Huge, huge thing. Beyond that, the hospital has a lot. Oh, ask to take a sitz bath home too. Most of them will just give it to you. They won't even charge you. Like, yes, this little thing that you can go home with and put in the sitz bath tea oils and make that tea and soothe there and have the, you know, your peri spray going. Buy some after ease, okay, to do after everything's done and you're cleared by your doctor to use it. And enjoy your little one, okay? Get support. Don't stay alone, and make sure that you're being introspective as far as where you're at emotionally, okay? Am I feeling now this super high? Okay, cool. Are you being frantic though? Then do a grounding oil like Balance or something to help bring you down a little bit. Are you feeling the slide downward? Especially if you've ever had any, you know, depression in your family, you've ever experienced depression, keep the conversation open, for one, with your husband, and two, be honest with yourself and seek out friends, seek out professional counseling, whatever you need. Use your citrus oils to help support that more uplifting feeling, okay? Be honest, really. Like, there's a lot of normal ups and downs, okay? You're not alone. You're not the only one who experiences that. It's very common. I remember coming home from the hospital and then the next day, from the doctor's office with Olivia. And I'm holding her and I'm looking at her and I just start sobbing. And my husband runs in, "Are you okay?" He's like ready to take the baby. And I'm like, she's just so beautiful. And I'm like a wreck, but like I'm happy. But he's like, this is a weird cry. So you're going to experience something. If it's not like that dramatic high or low, like there's going to be a lot of different waves. The 4-month mark is another wave, and that's usually when they go through a big sleep regression. So up to 2 years, you guys, is postpartum hormones and all this kind of stuff. So be aware. Make sure you've got people in your life checking in with you, who are encouraging you, and you're being honest with yourself, okay? So yeah, so go check out my essential oil video if you want to know more details about what I put in these different blends I'm taking, as well as why. And go check out my sitting video to know how to actually set yourself up so that you can, you know, your lower backs, your ribs, you're elongated and relaxed, and just keep pulling wide. You can even have your husband in there right now, like trying to make sure that the hips are just really softening so that you're going to have an easier labor and delivery, because that's what we all want. Yeah. So thanks for tuning in. We'll see you next time. Bye.